it's hard.
It is.
And it's getting very intense. And I don't know it's definitely getting worse. I also think that's related to like how they change up the NCLEX. The way they changed up the NCLEX, I probably wouldn't have passed if I had to take that.
Baby, let me tell you something. I mean, I took my RN boards. I took mine during COVID, so I had the lesser, the 65 questions or whatever.
Yeah.
And first of all, everybody always hates the multiple choice, or whatever.
Yeah.
People are like, oh, well, it's easier. It's really not easier. They just really cut out the 10 questions part of the 10 questions that don't even count. That's really what it was. But it's just, it's completely different in the way that they have to, the way that they ask questions now. So, it's totally, totally different. Like, I don't feel like I would have passed it either.
They have short answer. They have like mad stuff going on right now where you got to highlight things. I'm like, I don't know what. I don't even know what they asked. And I remember I didn't even realize my NCLEX ended.
Mm-hmm.
I was so stressed out taking the test, and then like I realized it's like specialty questions. And I'm like, what y'all got me doing right now?
Mm-hmm.
And I was highlighting the whole paragraph. I said, I feel like everything matters. I don't know. You need to know the patient name, the age. Yeah, this stuff matters too. He pooped? I think we need to know that too. I'm like, and I remember.
So you're highlighting the whole question.
The whole
question's highlighted.
And I'm like, what the hell is happening right now?
Mm-hmm.
And at the end, after I realized that it was a specialty question, I didn't even have to answer that. I told him, like, please don't incorporate this because you're not gonna have no nurses. You're not gonna have no nurses anymore. Like that test is wild. Like,
yeah, they're definitely making it harder for sure.
And we already have a shortage, so you need to make.
Y'all need people A.
Yeah, you need to just
people
A.
Y'all playing games B.
Like, I don't understand, but I still like nursing. I still do.
So so I know that, so you went from the ED, you got your, you said what you hated about the ED.
Yeah.
Now you're in labor and delivery, like it, hate it.
It's both. I feel like it's very hard to not have a love-hate relationship. Because you see the positive and see the bullshit.
Yeah.
So I love maternity, especially that not being one of there's not many Black women on the unit in general. I feel like a huge duty when I do see my Black moms there to like be their support, really advocate for them because I feel like who else is, and it's not the saying like white nurses aren't, but I know most likely my Black patient does not feel comfortable. Like, they don't know. You know what I mean? They don't. It's just a cultural thing. Like you feel like comfortable with who you're familiar with.
Yeah.
Typically. So I feel like that. I feel like that pressure caused me to actually kind of hate it because I feel like I can't. It's hard for me to fix things. Like when there's like certain policies, like why are we doing this? Right? I'm like, we don't need to start PIT. Like, and they're like, oh, just like it's Dr. So and so. Like they're upset, and I'm like, I don't care if that person's upset. Like, and I used to tell people, I'm like, there's actually nothing in the nurse's scope if you read the book. You actually take a second to read the book. That's I need to care for the provider's feelings. Be respectful. We coworkers. You know what I mean?
Yeah.
But I'm not gonna coddle your feelings. That's not part of my scope. My scope is to advocate for my patients, do what's best for my patients. You know what I mean?
Yeah, yeah.
And I feel like again on our particular unit, I feel like a lot of times the providers are coddled, and I don't like that. And I feel like in the ED, I didn't really experience that as much. I feel like people were more adult and less toddler. That's not even the word, toddlery, but whatever.
It's not toddlery.
Yeah. But I love working with like the maternity population. I do, and I feel like birth is like the one thing that like I'm like, wow, like
a miracle.
Yeah, like I'm like, how did
it's
like
crazy? Like every time I see it,
I'm like
it's not. I don't even. I wouldn't say like it's not a surprise.
But it's just like
it's literally a miracle.
Yeah, and I just feel like wow, like I hope my body can like also give birth like vaginally, like and just like and do things like not correctly, but as I tell people, like birth can be so like beautiful and things can go so right. Baby's healthy, mom's healthy, no bleeding issues, no problem with babies. But when like
it can change in a second. It can change in a second. I remember I was in clinicals, and I remember I was trying to get into everybody's like delivery. I was so interested in labor delivery, and like a lot, like 99% of every like female nurse.
I was the same way. I'm like my labor delivery clinic.
I was in everybody's room. And I remember there was a patient, she, healthy mom, healthy dad, baby comes out, and the baby was born with like half an arm. Like the arm didn't grow like past the deltoid.
Did they know
But
this on
they did not know because when they were doing the ultrasound, I believe that either the baby's arm was like hidden or something like that, or like the
Oh.
side. So but they just assumed like what, I guess there was a point where maybe they assumed that there was some digits or whatever. They did not know. So when the baby comes out, the dad actually was the one that realized that the baby did not have a full arm. And so it just went like, like
Why? Like so
it
like
was just such a wild kind of scene because like nobody was expecting that.
yeah.
But things like that happen in labor and delivery all the
All
time.
the
Like
time.
sometimes the ultrasounds aren't as accurate as you would like, or whatever. And then of course in that particular situation, then there was like a lot of workups that had to be done. And
Yeah.
I believe they were saying that the mom was using drugs and did not like her husband didn't know. She did not admit that, or whatever. So it was like I believe like that's what was the cause of it, unfortunately. But my point is that labor and delivery, although it is beautiful, it is the miracle of literal life, but it could also be death in a way too. Like it's just things can change in a second. In a second, like you can come in and everything's normal and end up with a hysterectomy, and it's your first baby,
And
like, and it shows
bad.
it's so like, and you won't even the thing is you won't even know. There's nothing that would clinically indicate that, and it's just, but that's something that we
Especially
have
when
to
you see young
carry.
moms.
Oh my gosh, it's the
That breaks
worst.
my heart.
Honestly, hysterectomy to me, it doesn't matter if you are a young mom, if you're an older mom. I just feel like it's an organ, and
Yeah,
it's your female organ. You know what I mean?
yeah.
Like it's just like this is what a lot of women like hold that to themselves because it's like this
Dearly.
is what makes you. This is
Yeah.
part of what makes you a woman. And so like now having this organ removed, and now even if you're like I said, it's worse for sure if it's a younger mom, but if it's an older mom,
And
it's
if they
just
can't
like
save your ovaries or
you,
anything,
and you
now you
gotta
hitting full
do,
menopause.
and like it's just such a like a whirlwind.
Yeah.
It can, and we have to bear that, so nursing is definitely not easy. There's definitely for sure things that you love and hate. And it doesn't, I don't think that there's any field really. I'm sure even like I said, people who doing IV infusions, I'm sure you have a patient that maybe like has is a heart stick or something like that, or a patient that's
We got that
could
too.
be very particular or whatever. Like there's always going to be some sort of love and hate. But I feel like one of the things that I realized coming into labor and delivery is that labor and delivery is actually hard. People come into labor delivery thinking like, oh my gosh, the babies and this is so sweet and I want to take care of mom and whatever, which is all great. But labor and delivery is actually hard work.
Tell you, people always ask me like, how do you feel about labor delivery compared to the ED? And I'm like, I run around more on labor delivery than I did in the ED. When even I had 6 patients.
Even if you had one patient.
Like you can't, I feel like I can't do nothing. Yeah. Like, it's literally like having a baby, like boom. I was biting a cookie. Because again, I didn't get a break, right? So it's hard a lot of times. A lot of nurses, we all experience this, like just trying to stay hydrated, trying to find time to use the bathroom. Like it's hard because boom, we could say, oh, do you mind watching my strip right quick? And we could actually be watching the patient strip. But now if our patient starts decelling,
I can't watch it.
I can't watch a strip now, right?
Right.
So now boom, I run into my room to try to, resuscitate the mom, lay the baby. Boom, your face start decelling in your room. And I'm like, now I come out, my strip, baby down. I'm like, yo, what's good? Like,
right.
You start running.
It's literally things can change in a second.
Like this. And the thing, baby just dropped. Mom don't change position.
Mom's fine. Mom's chilling. Like, don't even know what's happening. Yeah. Right. Your baby's on the umbilical cord or wrapped in it. So like, and we don't know, whatever. So it's like, we do have to intervene very quickly. But I think that a lot of people come into labor delivery thinking like, like I said, it's so sweet, but don't realize that it's hard work and it can get very overwhelming very quickly because not only do you have mom and baby, whether baby is in utero or not, even if you're recovering the patient, you still, and if your unit does not have a baby nurse, you're mom and baby.
And baby.
So now you have to still recover mom is trying to prevent a hemorrhage. B, she wants to latch. You got to help with that. Like,
and the baby that cannot give you any signs like it's not feeling well.
Yeah. Right.
If it's struggling to breathe, there's no signs.
Now you got to resuscitate. Right. Like, so it's just, it can get very, and that's the thing is like, sometimes you have two of those, going on, or sometimes you have demanding patients, like maybe that they don't mean to be or whatever, like, they have, questions or whatever the case is. You have two patients that you have to give your attention to, and you kind of like, like trying to balance that.
That's so hard, especially when they want to talk. And I'm like, yo, I hear you. I try to like walk away slowly, or because it's hard because like I want my patient to feel like they could talk to me. Right. I want to be a vibe for them. Right. Like, and I understand, like, you want to have a conversation. But homie on the other side, kind of needed a medication. They shadow check.
Let me tell you, I feel like in labor and delivery is a little different. I feel like it was worse when I was working med surg because I can't tell, and I feel like every med surg nurse can relate to the fact that you could be having a rapid response or a code blue with your patient, and if it's a private, whether it's a private room or whatever, you have another patient in your district on your team, whoever, calling you for a blanket, and you're like, I'm sorry, I'm saving somebody's life. Real quick, I just need you to bear with me just for a couple minutes. I just want to save someone's life real quick. And the thing is like, you can't even really be mad at them because they don't even know what's going on. They don't even know, unless it's like they're in a room, like they don't even know what's going on. And then when you get back to them and you're like things could change in a second there too. I can't tell you how many times it'll be like, I walk into a room, like, I want a blanket. And I'm like, all right, I'm going to go get a blanket. And now something's happening on telly. My patient's having a cardiac event that I have to respond to. I have to call a rapid response. Now I'm in a code with that going on. Finally finishes that. That's let's say it's at least 45 minutes or whatever. Mm-hmm. Cool. That's a short code. Exactly. And then I get back to my patient and they're like, well, thank God I did it. Exactly. And I'm just sitting there like, I'm so sorry. I do apologize. And I never want to be like, I just took care of a patient that nearly died. Like that was the problem. You don't want to make them feel bad, but they literally have no idea and nursing. This is nursing. This is nursing.
That's like when I was in ED at the time, and we could not get this IV. So the providers were doing an ultrasound, like guided one, and again, no break, didn't get to eat, no water, and I start feeling myself to get lightheaded. It's hot as hell in the room, right? And I'm like, yo, Tanesha, cannot pass out, right? Cannot pass out. And I'm like trying to like step to like pump my blood flow, trying to squeeze my fist. But she was like contractor, so I'm like holding her arm down so they can actually be able to like find it, right? So all I heard was the doctor say, I got it. When I started letting her arm go, because I'm like, I need to get out, because I felt it. And I took a step and I started going down, right? I didn't realize, like, I knew I was passing out, but I didn't realize, like, how intense it was that the provider was talking to me, and I was deaf. I couldn't hear anything. I saw her lips moving, but I literally could not hear anything. And I saw her hand, so I'm like, oh, snap, she wanted me to grab her hand. But it felt like everything was in slow motion. So I, like, grabbed her hand, and then all of a sudden, like, I guess I hit the floor, but next thing I knew, all the sound hit. And I heard, the fellow passed out. And, like, the loud, like, people started rushing in. I heard my patient talk about, she didn't get to charge my phone. She was supposed to charge my phone. And I'm like, damn, sis.
I'm sorry. I'm actually on the floor. Yeah. Real quick, my blood pressure is actually in the 60s. Not a problem. 1 second.
Over here right quick. Like, I'm charging right.
1 second. I'm for your phone, that's probably on 50%. You could relax.
I'm like, damn. Yeah. I'm like, you right. Let me charge it right quick. I finish passing out. Yeah. I'm like, but I'm
my bad. Oh, my bad.
And it was really funny. And then I'm like, I remember hearing that, whatever. They put me in a stretcher, hooked me up to the like EKG. They want to do the whole thing, give me fluids and everything. Mm-hmm. After that, they like, you should just go home. Mm-hmm. But before I go home, again, I just want to go back to my patient room, just to apologize. I'm like, so I go back there. I'm like, Miss So-and-so, I apologize for, but they're passing out everything. She was like, can you charge my phone? I said, well, goddamn. I said, "You right, sis. Let me shut the hell up. Tell you my little sob
and
story."
That's exactly what I get for coming back over here.
She hit me with the wet man, Mr. Wendy drive through.
Who was talking about that? What you're doing? I didn't ask for any of that. I wanted my phone charged, and that's exactly.
And I'm like, "You right, sis. My bad." And I charged the phone and walked out, went home.
I'm done. That's crazy.
Yeah, I would never forget that. And
that was is so wild. I cannot with people.
Like, patients, like, they just...
Where do you see yourself? Do you see yourself staying in labor and delivery, or what do you want to do? What's your next?
I'm actually trying to get into research now. I think I like big picture and like little picture. But I feel like right now, like, even when I'm on the unit, I'm always like, this doesn't make sense. So why don't we have something like this? Like, so I think right now I really would love to get into research and inventing something. Okay. Because like my homegirl who invented the little clamp on the little IV thing, the IV tubing, made millions to trillions. I'm trying to be the next one. Well, all she did was hit the little clamp. So I'm like, I would love... Motorola. Yes, I would love to invent something. Okay. And bounce like titties.
Okay, well, which titties? Cause
exactly, yo, you a hater. You a hater, yo. I'm like,
because I know y'all see it. Everybody got eyes see it.
I'm like, a little something.
Any bitty committee, that's fine.
Okay, my little mosquito bite. They get the job done.
Okay, that's okay.
They get the job
done. All right. Well, if you inventing, as soon as you make them coins, don't forget me.
Yeah.
Appreciate that. But no, good luck though. Like whatever it is that you set your mind to, you can achieve.
Yeah,
that's
bedside
for sure.
nursing. I do not personally believe that bedside nursing is meant to be a long term thing. I do feel like it's meant to cycle. I feel like it's so physical. Like I don't know how that could be like a long term thing, and I feel like at a certain point, I'm not gonna lie, you always can learn as a bedside nurse. Yeah. But I feel like there's a certain point where after that, you're supposed to like take what you learn. And I'm like, all right, I need to actually cause change. Like, you know what I mean? Yeah. So I feel like that is hopefully, I don't know. I'm talking right now. I'm trying to put it into fruition, but I would hope that's like...
I mean, for sure, there's definitely people that stay in bedside nursing for a long time.
And I
don't think that it's for everyone.
Yeah.
Yeah. I agree with you. And honestly, nursing is just so broad. That's one of the beauties of nursing is that you do not have to be stuck or
it's vertical and lateral mobility.
You don't have to start in the hospital if you don't want to. You could start in the doctor's office, you could start in a school, it's so wide and you can interchange,
That school nursing was sounding type nice. I can give out some ice let me tell you.
And call a parent and be like, hey,
like, what you
come pick up your child?
You know what I'm saying? I could give out. No, I'm not. But I know I hear like school nurses, they have a lot of documentation. They do.
I had interviewed actually, and I did it was through an agency, and I remember sitting through orientation, looking at the paperwork for documentation. Yeah. I promise you, I was like,
I think that's what they have to do a lot, pretty much.
I'm not coming back. Of documentation. That was my last day. I'm not. How about I didn't make it off
that
orientation?
Documentation is mad annoying.
Yeah. If you think labor and delivery documentation is annoying, documenting every 15 minutes and everything else that happens in between that, school nursing, yeah, I'm sorry, we're gonna get a school nurse on here one of these days, and they can share, but it's a lot. It's a lot.
I feel like you don't even see it, like even when I try to look up on YouTube, like you don't really hear a lot from like school nurses. So I think that would be like, cause I want to hear. Yeah,
it's not happening.
So, it's not happening. But one thing I could do is give out some ice for sure, though.
That's fine. Everybody get ice.
I'm like, I could definitely do that. And I don't know, night shift is also like killing me, which is why like I don't think I can't do bedside nursing long term on night shift. No way. Okay. No way. Day shift I could last longer, even a mid shift, but night shift is hard. And I know some people. Shout out to all the night shift nurses out there.
Me, because I'm a night owl. I would scream if I was on days. I'd scream. I'd probably need to be on a 1-to-1 with some mittens, with like, let's do a 4-point restraint. I'm going to lose my mind if I work days. It's just not happening for me. I can't do it.
I can't. But you know what my problem is? I think everyone in my life is so much on the day schedule. Okay. That like I actually don't see. Like I realized like I just saw my mom like the other day because my birthday came. So I was like doing that, and it was like working back to back pretty much. Like it was like 3 weeks. I'm like, that's crazy.
Yeah. You do miss a lot. That's the trade off,
Yeah.
I guess, for working nights is that yes, you do get night differential if your hospital does that, but yeah, you miss a lot
And I've
of
never been
stuff on
so
days.
tired like this
Yeah. If you're
before.
not used to it, it takes a while to get used
Yeah.
to. And if it's just not something that you flow with, then yeah, but depending on where you are, getting into days generally isn't easy.
Yeah.
Yeah, but research, I want to be doing night shift research. That not that I be seeing, so that's a good way to get into
That's the
a
thing.
day shift position.
And my thing is like my mom works really hard, like, you know, just when she had my sister and I as like when we were kids and everything. And I remember sitting on the couch just waiting for her 8, 9, 10 hours, just waiting for her nonstop. And my sister would try to get me to move from the door, and I just wanted my mom to come home.
Is your mom a nurse?
Oh no, my mom, she works at the post office. So
Okay.
y'all make sure y'all don't do none of that. That electric, that when they ask you do you want to do electronic paper on the website
For mail?
Yeah.
I didn't even know that was an option.
You know, you could do the electric billing, or like they can send you your stuff in the mail. Make sure y'all hit that mail button, because my mama need her job. Thank you.
Okay.
All right. Thank you.
Post office, they shutting down post office workers. I feel like there's a shortage of post office.
I don't know, but I need my mom.
I don't feel like they are.
I don't know,
because I'm like
my mom.
I do have paperless billing now.
Yeah, that's what you call. My mom pressed me. Let's talk about my mom pressed me. Right. So boom, my health insurance, right? My mom, again, Caribbean mom, she don't know how to not open my mail.
Right.
So she testing all the mail I get. So it was Fidelis, right?
Mm-hmm.
They happened to, I don't know if I clicked the paperless billing. I don't know what happened. But one day she was like, how can you don't get mail from Fidelis anymore? And I'm like, I don't know. I wasn't really pressed. Like my insurance still worked. That's all I need, right? She was like, you a traitor. She was like, you don't want me to have a job. You selected the paper.
You might as well have crossed the picket line.
I'm like, it worked that fast. Like, I'm like, me selecting paperless on one company, you won't get the job next day.
She damn near tore you up.
Yeah, no, she's not playing. So I've always been like, I get so nervous every time I see it. It's like trauma. I'm like, nah, I got to support my mom out here.
And post office advocate.
Yeah,
that's fine. That's fine. Okay, I see how you do it. Get your coins, okay? See the side hustle.
Hey, my mom's insane. She's insane.
Well, thanks for sharing. So now we're going to get to the point where we go to our nurse's note. So nurse's note, for those of you, if this is your first time tuning in, I wanted to create a part of the show where we are able to document our own part of the story in terms of what we're sharing. We always have to document, no matter what kind of nurse you are, you have to document. And so the nurse's note is where you're going to share a story that you feel like people should know.
I guess I'll start talking about, again, how you told me, like, getting into nursing in general. Like,
okay.
Start like just in nursing school. Nursing school is hard for many reasons. I think just in general, like, just entering your career, it could just be a little scary. Like, man, like, this is what I'm going to do. And most people assume this is what you're doing for the rest of your life, or especially when you invest like debt, taking out loans.
Yeah.
So in nursing school, I moved from New York to Maryland. That's where I went to nursing school, and I personally did not enjoy my time. I experienced like a lot of microaggressions, and it was me. I think there was in total 5 Black women in my nursing program, and they for sure made it obvious that we was the 5 Black women in the nursing program. And I remember one time with me and my 2 like friends, Janie and Ashley, were sitting in class chilling. Right, we was tired. We went to class early just to like decompress before like everybody else came in who weren't Black. Came in, right. Our professor came up to us, and mind you, we don't know this lady. To me and this lady, and she comes up to us, and I lied to you not. She said, smile. She like, are you gonna be my ruckus group? So I'm looking. So I'm like, what? We wasn't even talking to each other. Janie sleep, Ashley on her phone, and I'm just chilling. So I'm like, what is that supposed to mean? And she starts laughing, and I'm like, no, like
what's funny?
Yeah, I'm like, what is that? What do you mean by that?
Right.
Like you said those words, you chose that word for a reason. Like what's your I don't understand. She's still laughing, right? So now the class comes and everything, and I'm amped now because I'm like, yo, what is that about? So she walks up to her podium, and I walk up to her. I'm not that close because I already know I'm black. They real quick to call people aggressive in general. So I'm like, excuse me. I'm like, I just really want to know. I'm like, we were just sitting there. We weren't even talking and everything. Like, what do you mean? Like, ruckus group, right? And she's like, oh, she got to start class. No problem. Cool. But one thing about me, I'm going to follow up. So I sent an email, right? Because I need documentation of this too. This is not just going to be a hearsay conversation.
Yeah.
So I sent email and I pretty much draft the whole thing, say what happened, what occurred, at what time, and I'm putting timestamps on everything, right? And I'm waiting for a response. She doesn't respond, so I sent another email and I tagged more people in because I'm like, hey, just following up on this. I'm like, now I was very concerned. I'm uncomfortable.
Yeah.
As a student, I'm like, and I specify I'm one of the only 5 Black women, and I just want to know like why was this only said to us 3?
Yeah.
Right.
Who weren't doing anything.
Yeah. The rest of the group came in hooting and hollering.
Yeah.
Right. We ended up having a meeting, and I don't even remember what happened fully, but she ended up having this whole thing like, oh, she didn't mean anything by it, but I'm like, why did you say it?
You said it, and you also felt comfortable saying it.
Why did you say it?
Right.
But in that nursing, like my nursing program, I felt it was like multiple like things occurring. From that, there's one time, for one of my classes, took an exam. I did pretty well. I did the best out of the class, right? But again, I found it very interesting that because of that, they decided to email me to ask me. They said they wanted to retake the exam for what?
That's crazy.
I'm like, and it wasn't even like, oh, right after class or the next day, they hit me up talking about like, we felt like you cheated or whatever. I'm like, this is 2 weeks later, you graded, and now you're saying that. So you're assuming I cheated because I did well?
Right.
That's wild.
That's wild.
Right? And then what sent me off the edge was that there was another girl who's white, I think she ended up having like, it was close. She had like a 94, 95 or something like that. And I asked her, I'm like, did you get an email about retaking the exam? And she's like, no, what are you talking about? So I'm like, okay, so we both did well.
Well, why is it you?
Why? Like, yeah.
Right.
So I told her, I'm letting y'all know right now, I'm not taking nothing. And I told her, I feel like y'all discriminating. Y'all can say, oh, I'm pulling the card. I'm going to tell you how I feel, and I'm not going to feel ashamed about that. Because people like to make people feel ashamed for pulling the black card, quote unquote. I'm pulling it because it needs to be pulled right now. Right? You pulled your card, I'm pulling my card. We're going to play this game.
Yeah.
But just with that, I just felt like even in nursing, like I feel like it carries a lot. And you can see on how like even it's like the spec of Black nurses and like specialty fields. It's just, I feel like it's just in general, it's hard for, Black people, like just Black people in general, but it's hard for us like getting on specialty units or like we deal with microaggressions. And I just feel like you just learn like how to navigate through that.
Yeah.
Right? Because you can't let that stop you from being in the career that you want. You still worked hard. You still deserve to be there. Don't let anyone ever make you feel like you don't deserve to be there. I'm here because I'm meant to be here.
Right.
But it was just like in nursing school, I'm actually appreciative that it happened to me in nursing school because it helped me navigate it early when I wasn't making money. I didn't have my license and stuff. So that like I wasn't acting a fool and then like risking my license just for people saying ignorant nonsense. Stuff. Yeah, you know what I mean?
Yeah, I got
so
you.
Now like when I'm on the unit, because stuff still happens, people are just ignorant. Like I peep, I hear, I say, okay, cool. But I know how I'm gonna go about certain things.
Yeah.
You know what I mean? Like, so I feel like nursing and like those things I experienced helped me just like that throughout my career.
Okay.
But so everyone out there going to be a nurse, this is just in general. Like you just have to like figure out like one, why you're a nurse in general. And once you figure out that, don't let anyone break your values, regardless of if you're dealing with microaggressions, if you're just dealing with people just saying like you're not meant to be there, you stupid. Some people judge your skills as a nurse. You know what I mean?
Yeah.
Some people say, oh, you're not meant to be a labor delivery nurse, or you're not meant to be an ICU nurse, you're not meant to be an ER nurse. If you want to be there and you are there, keep telling yourself you are there for a reason. And I feel like just that's my note.
Okay. No, and a tip. Okay. All right. Well, thanks for sharing. I loved having you on. We'll see when you want to come back. Whenever you inventing something or letting us know how you do in research. If you like if and when you get there,
I'm gonna start applying. So
okay. So we'll definitely have you back so you can share what that's like for those people who want to go into research. But that'd be dope. Thanks for coming.
Thank you.
Thanks for stopping by. Hey.
Big T. Nurse T.
Oh, I was gonna say, not big. It's not Nurse big. T. It's not big. This part ain't
big.
Were
really,
because
that's what I thought you was going.
That's what I was like, I'm hating.
When I let me tell you something.
Yeah.
When I go get that, okay, when they got the little skinny BBLs, I ain't gonna do it. But when I get my little,
we're here for it.
Don't play. I'm gonna be acting a fool.
I'm sure you will.
Okay.
I'm sure you will. I will be the first person buying a flight to New Orleans so you can get some
thank
beads.
You.
You're welcome.
Thank you.
All right.
The red nose.
Make sure exactly. I'm so excited.
But I enjoy it. I love this.
Oh yes. Thank you so much though. This is like such a project of mine in my heart. This is not gonna be on. Yeah. But I really want I am passionate about this, but like I said, I feel like I want it to be something that is therapeutic to people. Like at the end of the day,
I love podcasts. I just be listening to them driving my car.
Yeah, that's what I'm saying. I love listening to stuff too. But I always feel like, and you know what? The other things too is like I swear, like I'll be talking to my husband or whatever about anything like nursing related. He don't know what's going on, and I'm like, I feel like I need to talk to a nurse. Like only nurses can understand what we go through, and why a doctor put in an order for a bolus into my patients in heart failure, and I don't. Girl, can we think? Are we like thinking? If it's July, I already know it's gonna be foolishness.
Yeah, exactly.
It's foolish season. Don't come to the hospital. It's foolish season.
Exactly.